Hello,
Hello.
my name is Monica and I'm one of the registered nurses on duty today. Could you please give me your name?
Hi, my name is Karen.
And how may I address you, ma'am?
You can call me Karen.
Alright, Karen, how can I help you today?
Well, you see my son Bobby right here. He has ingested a metal
Mm-hmm.
coin and I'm really worried about him.
Mm-hmm. I see. Well, I'm sorry to hear that, but try not to worry, Karen. You have come to the right place and we will do our best to help you out. Now, before proceeding further, I would like to ask you some questions to get a better understanding of your son's situation. May I do that?
Yeah, sure, go ahead.
All right, Karen. Now, you told me that your son ingested a metallic button. Can you tell me a little bit more about the button itself?
Well, you see, it happened in my house
Mm-hmm.
about an hour ago. Bobby was playing with his toys, and then he came to me and he showed me another a metal coin that was
Mm-hmm.
similar to it, and he told me that he had eaten a coin similar to that.
Mm-hmm.
It's a metal button, it's not very
Mm-hmm.
sharp, and it's about half an inch big.
I see. And after this incident happened, did you notice anything different about your son? Anything that might be making him uncomfortable?
Well, aside from telling me that he had swallowed the button, there is nothing out of the ordinary. He seems okay.
All right. Now I'm just gonna list some symptoms. Please let me know if he has been experiencing any of these things. Has he been experiencing nausea, vomiting, fever, or stomachache?
No, not really. That's the surprising part. Bobby has been acting really quiet lately
Mm-hmm.
and he doesn't feel hot. He does not have any of the symptoms. And for
Mm-hmm.
someone who has swallowed a metal button about a
Mm-hmm.
half an inch big, he
Mm-hmm.
seems really chill.
Well, still, I'm glad to hear that, Karen. Could you also tell me when did this incident take place?
It took about an hour ago, as I have said, in my
Mm-hmm.
house.
All right. And what did you do at home to deal with this problem?
Well, I did not understand what I could do at home to deal with this problem, so I brought him straight up to the hospital because I was out of my wits.
I see, Karen. Well, you did the right thing. Has he eaten anything or drunk anything after that?
No, as you see, since I brought him straight to the hospital, we had no chance to give him any food or water or anything else, as I thought this would may hinder the process.
I see. So, what you have told me so far is that your 2-year-old son swallowed a metallic button about an hour ago, after which he hasn't shown any unusual symptoms and hasn't eaten anything. Now, is that correct, or would you like to add something to that, Karen?
No, that's all.
All right, Karen. Now let me explain to you what will be done next to help your son. First of all, his vital signs will be taken, after which he will be required to wait in the waiting area. And after that, the doctor will examine your son and decide the appropriate treatment plan for him. Am I clear?
Yeah, you're clear, nurse, but I'm still very concerned about Bobby.
Mm-hmm.
Now, can you tell me how long will it take for a doctor to see my son? It has been an hour so far.
Well, I understand your concern, Karen, but you see, the waiting time will depend on two things. First is the availability of the doctors, and secondly, the priority of the cases.
But nurse, my son should be a high priority case for you. You see,
Mm-hmm.
he has ingested a metal button, a
Mm-hmm.
coin.
Mm-hmm.
It may cause an internal bleeding, and even though he may seem fine, I think that he
Mm-hmm.
is not fine. Can you not hurry him up to a doctor?
Well, I understand what you're saying, Karen. If I were in your place, I would also worried about the same. But I want to assure you that your son does not currently have any signs or symptoms indicating internal bleeding or anything else for that matter. Because he's in a stable condition right now, we don't have anything to be alarmed about. Do you understand my point?
Well, yeah, Bobby seems a bit chill, so I guess he hasn't shown any symptoms either.
Mm-hmm.
Now that you have told me and I have this information, I feel a lot better.
Mm-hmm.
I'll call him up for whenever you call him
Mm-hmm.
for the doctor for the checkup.
Yes, certainly you can call your son for the vital signs that we can take later. But before that, do you have any other questions that I can answer for you, Karen?
No, thank you, nurse. You have been a blessing.
All right. Karen, could you please now call your son in?
All right, come here, Bob.